Hello, I am Ranitha and I am a neurophysiology scientist.
Hi, I'm Amanda and I'm an intensive care nurse. Satya Sai Baba says, health is wealth. He explained that we and not others are in charge of our bodies and minds.
The nervous system is a complex collection of nerves and specialized cells known as neurons that transmit signals between different parts of the body. We could describe the nervous system as a complex network of electrical wiring in the human body. Structurally, the nervous system has two components, the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain, spinal cord, and nerves. The peripheral nervous system consists of sensory neurons, ganglia, which are clusters of neurons, and nerves that connect to one another and to the central nervous system. Functionally, the nervous system has two main subdivisions, the somatic or voluntary component and the autonomic or involuntary component.
The function of the autonomic nervous system involves regulation of the organs, without which your body may not be able to have mental awareness and cognitive ability, sufficiently regulate emotions, regulate heart function, regulate breathing, maintain gut function, have sufficient bladder control, and maintain reproductive health. What is the peripheral nervous system? The peripheral nervous system consists of sensory and motor nerves connecting the CNS to organs such as your skin, arms, hands, legs, and feet. It allows the brain and spinal cord to send and receive information from and to other areas of the body. Today we are talking about only one peripheral nerve, called the median nerve, and a common disorder related to it is called carpal tunnel syndrome, commonly known as CTS.
What is carpal tunnel syndrome or CTS? CTS is a type of nerve entrapment at the wrist, namely of the median nerve, which runs along the wrist through a very narrow tunnel, which is called the carpal tunnel. So what does this median nerve do? The median nerve provides feeling and movement to the thumb side of the hand. This includes the palm, the thumb, the index finger, the middle finger, and the thumb side of the ring finger. These are called digits 1, 2, 3, and 4. What could be some of the signs and symptoms of CTS? Commonly, you can get numbness and tingling of the thumb and the first two fingers of the hand, especially at night. Another common sign is numbness or tingling in half of the ring finger. We call this splitting of the ring finger. You may get some weakness in the hand, especially when performing normal tasks, like gripping objects. In severe cases, you may even get wasting of the small muscles in the hand.
Anyone commonly between the ages of 30 and 60 can develop CTS over time with repetitive use of the hands, which may affect mainly the dominant hand but can involve both. What may be the possible causes of CTS? Use of the hands by making the same hand and wrist motion over and over a very long time. Use of the computer keyboard and mouse. Sewing. Use of power tools. General housework and cooking, involving repetitive wrist movements.
How do we test for carpal tunnel syndrome? One of the tests is an electrical test called a nerve conduction study, an electromyography. Electrodes are placed on your hand and a little stimulus is applied to your nerve via a probe at the wrist. This is done over the skin. It is also done over other points of your arm and hand to test both the motor and sensory function of the median nerve. It is not a painful test, but it is more uncomfortable and an unusual sensation. We would also test another important nerve in your arm and hand called the ulnar nerve, which we commonly call the funny bone. This is to compare and help confirm that there is in fact a problem with the median nerve only, as opposed to any other nerve or neuropathic conditions causing the symptoms. Sometimes a fine needle may be inserted into muscles, but this is not always the case. Other examinations that can be done are a Tunnel's test and a Phelan's test of the wrist.
So how is it generally treated? Treatments are usually dependent on how severe it is. In less severe cases, you may be advised to wear a splint at night as needed to protect the wrists in a suitable position, or even during the day as well to avoid sleeping on your hands or wrists. In more severe cases, you may need surgical release of the median nerve from the carpal tunnel called a carpal tunnel release. What should I do if I think I have symptoms? You should see your GP and explain your symptoms as best as possible, and you may be referred to for nerve conduction testing if appropriate. So some pointers to maintain general nerve health: pay attention to changes of sensation or pain in the body, ensure adequate vitamin B12 intake and vitamin B12 levels, especially on a vegetarian diet, on diabetic medication, or if medically indicated otherwise. Seek initial medical help sooner rather than later to avoid developing more severe disabling symptoms. Nutritious diet and exercise, and caution when performing everyday tasks. Generally, eat right, move right.
So, what if you have diabetes? Diabetes can cause several nerve problems, and an example being a diabetic polyneuropathy, where more than one nerve is affected. If you have diabetes and have symptoms of carpal tunnel syndrome, it is unlikely that it may be just CTS. You should contact your GP if you have diabetes and you feel you are experiencing nerve pain, numbness, and tingling.
So coming back to health is wealth, take care of your hands and wrists.
As hands that serve are holier than lips that pray.